The hearing will come to order. Thank you to our witnesses, and I know I was running a little late, so I don't have an opportunity to greet our witnesses, but thank you for being here, and I'm grateful to be here with Ranking Member Braun. This month marks the 50th anniversary of the Rehabilitation Act amendments of 1973. When they became law, these amendments prohibited discrimination on the basis of disability by the federal government in federally funded programs and by federal contractors. With the passage of the Rehabilitation Act amendments, the federal government made it a priority to ensure that every person has access to government programs and services. It also established the foundation for the Americans with Disabilities Act, passed some 17 years later. Since the passage of the so-called Rehab Act, technology has become an important doorway to government services at the local, state, and federal levels. The COVID-19 pandemic showed us again the importance of using websites and apps as a way to access government programs, services, and information. Last year, this committee examined the compliance, or I should say examined compliance, of one part of the Rehabilitation Act, Section 508, which requires federal technology to be accessible for and usable by people with disabilities. One of our witnesses, Julianne Lieberman of Devon, Pennsylvania, testified she could not access CDC's COVID data. Julianne told us at that time, quote, "In crisis times, all need access to trusted information and services," unquote. This is true for federal agencies. It's equally important for state and local governments that provide critical services, especially those related to safety and emergency response. In December of this past year, I released this report. The name of it is Unlocking the Virtual Front Door. This report found accessibility problems with technology at the Department of Veterans Affairs and unfortunately throughout the federal government. I'm pleased that because of bipartisan efforts with members on this committee and throughout Congress, some improvements have been made. The Veterans Administration reorganized its Technology Access Office and bolstered its efforts to make VA technology accessible. The Justice Department and the General Services Administration committed to new oversight and transparency of accessible federal technology. Many inspectors general are also taking a new look at accessibility. For example, the VA Office of Inspector General plans to release a report on the accessibility of VA technology in the coming months. And we've seen progress to improve accessibility of state and local government resources. In early August, the Department of Justice issued a proposed rule setting website and technology accessibility standards for local and state governments. These long overdue proposed standards are necessary to ensure people who are blind, deaf, have physical disabilities, or intellectual disabilities can access programs, services, and information provided by local and state government. So I commend the Justice Department for issuing these proposed rules. I know that the public will help strengthen them, and I look forward to the final rule to make all government technology more accessible for all Americans. These are positive steps. There are more. There's more work we can do. There are positive steps we in Congress can take. Recently, I worked with Senator Rick Scott to introduce the Veterans Accessibility Act. Our legislation would create a VA advisory committee to oversee VA's compliance with all accessibility laws. People with disabilities would serve on the committee providing important feedback. And today, a number of senators and I will introduce the Federal Agency Accessibility Compliance Act. Our bill will bolster the role of federal Section 508 compliance officers in federal agencies, require agency and department heads to personally certify that their organization's technology is accessible, and to post plans and timelines if their agency technology is not accessible. These bills are common sense legislation designed to ensure federal government services, programs, and communications are accessible to all Americans. So we have much more work to do to make websites and technology at all levels of government accessible, or I might add, fully accessible. I look forward to hearing from our witnesses about how we can accomplish that goal, and I would now turn to Ranking Member Braun for his opening statement.
Thank you, Mr. Chairman. Technology has definitely changed the way we all live, no doubt about it. It's been around for a long time. During COVID, though, far too many in-person services were closed. People were forced to turn to the internet for basic services from food to healthcare and even local, state, and federal government services. I caution against ever closing physical doors again. Some places, technology is not widespread. Even in a state like ours, where we've been working hard to get it into every nook and cranny, many rural areas did not have adequate, good, high-speed internet. We're relying on it more and more all the time, even though we need to keep, I think, person-to-person services open as well. We need to, with technology, design it with accessibility in mind. Section 508 of the Rehabilitation Act mandates that federal electronic and information technology be accessible to people with disabilities. However, we've heard from many constituents that the federal government has not done a good job at complying, far too often leaving people with disabilities behind. That is why I joined with Chairman Casey in requesting a GAO study into the federal government's compliance. While this law generally does not apply to states, many states have taken it upon themselves to improve the accessibility of their services. States are generally going to be a lot more responsive, a lot quicker at getting something done, not to mention that they're a laboratory of different ways that might make sense for other states to pay attention to and rub off on the federal government as well. While this law generally does not apply to states in a mandatory way, it's still we should not rely on this place to craft those solutions. In Indiana, for instance, mobile and digital services are available, and we've done a good job with it. For more than a decade, the Indiana state government website has included screen readers, quarterly accessibility audits, high contrast views, and modifiable screen size. In 2021, Indiana added a new feature, Accessiby, which allows users to modify their experience for various accessibility profiles, including seizure safe, vision impaired, cognitive disability, or blindness. State works with local governments to make their website platform available to them. So far, more than 70 local governments in Indiana use the state government platform of 92 counties. That's a pretty good percentage. We've got places like Bosma Enterprises in Indiana that have been on this pursuit for a long time. It utilizes cutting-edge assistive technology and computer training programs to help Hoosiers with vision loss regain their independence. I ask unanimous consent to enter into the record a statement from Bosma Enterprises.
Without objection.
This type of work is not unique to just Indiana. States like Colorado, Ohio, Oklahoma, who we will hear from today, are all leading in technology accessibility. We must ensure that states do not lose the flexibility they need to continue to introduce programs and mechanisms that work best for their unique communities. I am encouraged by the state's leadership and urge them to continue to explore ways to improve accessibility. I yield back, Mr. Chairman.
Thank you, Ranking Member Braun. Now we'll introduce our witnesses. Our first witness is Mr. Chris Westbrook of Williamsport, Pennsylvania. Mr. Westbrook is an experienced programmer and an accessibility engineer for Alliant, a company that evaluates whether websites are accessible for people with disabilities. Mr. Westbrook is blind, hard of hearing, and has a mobility disability. That means he knows firsthand how inaccessible websites can impact people with disabilities. Mr. Westbrook will discuss those personal experiences. He will also talk about the more common website barriers he has learned from his work. Mr. Westbrook, thank you for testifying today. Our second witness is Ms. Ronza Othman. Ms. Othman is president of the Maryland chapter of the National Federation of the Blind. She is also president of NFB's National Association of Blind Government Employees. Today, she will discuss how members of these organizations have been impacted by inaccessible government technology at the federal, state, and local levels. Thank you for sharing those stories with us today, Ms. Othman, and I now turn to Ranking Member Braun to introduce our third witness.
Mr. Jay Doyle is the CEO of Service Oklahoma, a state agency focused on making it easier for people in Oklahoma to get the services they need. Service Oklahoma is a model of state innovation that has been nationally recognized. Jay is a visionary leader with a diverse career that revolves around service. His work has been recognized through multiple accolades, including the OKC Biz 40 Under 40 and Oklahoma's Next Generation Award. Jay earned his Bachelor of Science in Biochemistry from the University of Oklahoma. He lives in Oklahoma City with his wife and daughter, and I understand you had an anniversary yesterday. Happy anniversary, Jay, and thank you for being here today to testify.
Thank you, Ranking Member Braun. Our final witness is Ashley Lickley. Ashley is the Americans with Disabilities Coordinator for Salt Lake City, Utah. Previously, she worked as a disability advocate at the University of Arkansas, Little Rock. She will discuss why accessible websites and apps are important for Salt Lake City, as well as the city's efforts to make its technology more accessible. We appreciate you taking the time to testify. So now we'll start with our witness statements. We'll start first with Mr. Westbrook. Please share your opening statement.
Good morning, Chairman Casey, Ranking Member Braun, and members of the Senate Special Committee on Aging. I am a blind Pennsylvanian serving as the Secretary for the Board of Directors of the Roads to Freedom Center for Independent Living of North Central Pennsylvania. I also am president of the National Federation of the Blind of Pennsylvania's Deaf-Blind Division. I also work in the field of web accessibility as an accessibility engineer for a company called Alliant. So I deal with accessibility issues on a daily basis, both personally and professionally. Government websites must be accessible so that all constituents at all levels of government have access to programs, services, and information. For example, imagine not being able to file your local taxes online. This is a situation I face simply because I have a disability. When I went to the county website to pay my taxes online, I couldn't because I couldn't find the button used to submit the form. This ultimately forced me to seek sighted assistance to perform a task that everyone else can perform independently. Being forced to use sighted assistance means that I have to reveal private and sensitive information to someone else, something a sighted person would never have to do. I have also tried to use our city's website, but I don't think I am getting all of the information as the links all announce there's a submenu that I cannot access. This could result in missing key local services. People with disabilities need to be able to perform the same tasks as our non-disabled peers when it comes to work, recreation, and community living. But how do we get there? To make government websites accessible, we must embrace standards such as the Web Content Accessibility Guidelines, WCAG. We must also recognize that accessibility is not a one-and-done deal, but is always changing due to advances in technology and changes in website software. To ensure that government websites and technology are accessible, people with disabilities need to be involved in the development of the websites and the monitoring of the websites to ensure they remain accessible. One strategy for ensuring accessibility is to have people with disabilities, in conjunction with non-disabled advocates and peers, test and monitor websites and technology together. At Alliant, we perform what is called paired auditing, where a native screen reader user is paired with a sighted auditor. This helps ensure that the disabled are getting an equitable experience to non-disabled users and ensures possible barriers to accessibility are identified for all types of disabilities, not just blind people. For people like me, and really for all Americans, accessibility needs to become just another part of doing business. Accessibility must be considered from the design phase all the way through the process of implementing and maintaining a website. That is how we make government technology and all technology accessible. Again, thank you for your time, and I hope my testimony and expertise can move us closer to a world that is accessible to all.
Mr. Westbrook, thank you for your testimony and thanks for your good work. We'll now turn to Ms. Othman for your opening statement.
Good morning. I would like to thank Chairperson Casey, Ranking Member Braun, and all of the other members of the Special Committee on Aging for this opportunity to offer testimony on the impact of inaccessible technology in government. My name is Ronza Othman, and by day I am an employee of an executive branch federal agency where I'm an attorney and manage equal employment opportunity and civil rights programs. However, I'm testifying before you in my personal capacity, as in my spare time, I serve as a leader in the National Federation of the Blind. As Chairman Casey indicated, my roles include serving as the president of the National Association of Blind Government Employees, where I engage with current, retired, and prospective employees of federal, state, and local government agencies across the nation. I'm also the president of the National Federation of the Blind of Maryland, representing blind and low vision Marylanders who work for government, but who also, like most Americans, engage with federal, state, and local government for a variety of reasons. Access to information and communication technology, including hardware, software, web, and mobile applications, and other platforms and information, is a critical civil right for the blind, other Americans with disability, and the ever-growing aging population. Technology has been a true equalizer for blind and low vision Americans, as well as many others with disabilities. So much of the information we receive on a daily basis is communicated visually, and the proliferation of technology has enabled our community to gain access to that information at the same time as our non-disabled counterparts. Today, I can use the phone in my pocket to operate my Ring doorbell, operate my vacuum, set my thermostat, reheat my leftovers, and half a dozen other tasks in my house when I'm not even at home. These are all mainstream technologies, not adaptations made for people with disabilities. However, the origins of these adaptations resulted in mainstream technology. In essence, when a manufacturer or developer chooses to build a product and includes accessibility at the beginning, virtually everyone can use it. But when it comes to engaging with our government, these technologies are woefully behind. Often, government procured, maintained, or developed ICT is not accessible to those of us with disabilities. It's neither difficult nor costly to make ICT accessible for individuals with disabilities. If accessibility is baked into the system at the development stage, it's simply coding in a way that ensures information is tagged properly and navigable by assistive technology. Imagine making a pizza and adding the pizza sauce. Now, imagine making a pizza and omitting the pizza sauce prior to baking it. Then imagine trying to put the sauce on after the pizza has been baked, sliced, and even some of it served. It's a difficult but not impossible task to fix the pizza, but it would have been a lot easier to just have added the sauce from the beginning. Here are some examples of our members have experienced that illustrate the impact of inaccessible technology. A substitute teacher in one county school district was told that she would not be assigned to the district's middle schools because their attendance recording system was not accessible with her screen reader. A state employee newly hired to work at a call center for a state comptroller's office had her job offer rescinded after the state determined its tax information database was not accessible with assistive technology. A Department of Defense employee was kicked out of a training program in which she had been enrolled for 5 years and had nearly completed when her agency determined that its testing systems for certification were no longer accessible to assistive technology users. Dozens of state employees in a number of states who use the same software application could no longer enter their time and attendance in their state's timekeeping system due to updates that broke accessibility. Law enforcement entities have to enter information about law enforcement officers that are under investigation, which would then potentially render their testimony problematic. Prosecutors have to check those databases and disclose in discovery if any officers are under investigation. However, if they fail to do so, the entire case is likely to be thrown out and potential criminals are set free. In the last few weeks, I've heard from 2 different blind prosecutors from different sides of the country who have had near misses in terms of disclosing this information to opposing counsel in discovery. The reason? The system is not accessible to assistive technology. Imagine a scenario when it wasn't a near miss, but because the prosecutor didn't have effective accessible tools, they unknowingly failed to disclose such information, which resulted in a case being thrown out and a potential violent criminal being released to commit another crime. Had the technology been accessible, this wouldn't be a concern. These are just a handful of examples, but there are hundreds, if not thousands, of others. In my written testimony, I shared some recommended actions that will improve 508 compliance across the federal government. Chief among them is that the Access Board must be sufficiently resourced to do the job it has been tasked, and there have to be improvements in accountability and enforcement across the federal government. I also shared in my written testimony information about which states have laws and policies related to technology accessibility. I shared some of the recommendations for state and local government to improve in this area. One key framework will be the ADA Title II regulations. However, the Notice of Proposed Rulemaking proposes 7 new exceptions that are so problematic that they will erase decades of progress in the accessibility space. We strongly urge the Department of Justice not to adopt any of those new exceptions. We work in government, those of us who do, because we care about this country and the people who live in it. Though our eyes don't work in the typical way, we are capable of serving the public and doing so well, provided the technology is developed with basic accessibility in mind. In a day and age where technology advances at the speed of light, we are not limited by our disabilities. We're limited by the government that fails to include our needs in its technology infrastructure. This is not a capability problem. This is a willingness problem. Do federal, state, and local government have the willingness to be different? Only time will tell. Thank you very much.
Ms. Othman, thanks so much for your testimony. Before turning to our next witness, we were joined by Senator Blumenthal and Senator Kelly as well. Mr. Doyle?
Honorable members of the U.S. Senate Aging Committee, I'm honored to testify here today to tell Service Oklahoma's story on how we are improving accessibility of government services for all Oklahomans. Home to 4 million people, the state provides vital services to citizens during some of the most important times of their lives. From obtaining essential documents like birth certificates, driver's licenses, motor vehicle registrations, and professional licenses, to facilitating employment opportunities, Oklahomans rely on efficient and responsive government services. However, as we have witnessed, these services are often necessitate navigating a labyrinth of agency websites, offices, and phone numbers, a problem magnified during the pandemic when access to these services became more critical than ever. Citizens found themselves waiting on the phone for hours or even camping outside agency offices overnight just to secure their spot in line. It was clear that a transformation was needed. Service Oklahoma was created by the Oklahoma Legislature in May of 2022 with a mission to ease citizens' stress in navigating and obtaining government services while providing a great experience. Starting with your stereotypical DMV services, Service Oklahoma started the administration of our driver's license program in November of 2022 and our motor vehicle program for the state in January of 2023, transferring those existing functions and employees from the agencies that previously offered those services. Today, we're responsible for 7 million transactions and generate almost $1 billion in revenue for the state on an annual basis. The overarching goal of Service Oklahoma is to create a seamless, consistent experience, regardless of whether you visit our website, call our customer support representatives, or come see us at one of our strategically located locations spread across all counties of the state of Oklahoma. We want to meet Oklahomans where they are, designing services around the citizen, making services easy to understand, available when and where they need them, and being proactive instead of reactive. While still in our infancy, we've been able to significantly improve our services and launch various new and improved digital products for our citizens. There's one that I want to specifically highlight, which also happened to be our first product launch, the Disability Parking Placard, which impacts almost 100,000 Oklahomans each year. Historically, disabled Oklahomans in need of a disability parking placard were required to complete a 10-step process that often included repeated contact with their approving physician and multiple visits to the Department of Public Safety headquarters in Oklahoma City. For Oklahomans outside of the Oklahoma City metro area, this step would require them to travel for hours before they had the benefit of the disability parking placard. Once the customer navigated the cumbersome application process, they were left with no means to check the status of their application while they waited on average of 45 days to finally receive the disability placard. The process was further complicated by the fact that their applications were occasionally lost during this process. These obstacles created by the original process led to poor customer satisfaction and in some instances served as a complete roadblock to Oklahomans' ability to receive government services. A multi-agency collaborative program was launched by a team now known as Service Oklahoma and the Oklahoma Department of Public Safety to reimagine this process for obtaining a disability parking placard in a more customer-centric, digitally oriented, and accessible manner. The team also worked with the Oklahoma Medical Board to engage physicians in this pilot process. The high-level strategy behind the digital disability placard was to understand existing pain points from the perspective of all stakeholders, but especially the customer, and iteratively improve each version of the online product based on surveys and interactions with disabled Oklahomans, employees who process the applications, and physicians. The resulting disability placard product dramatically improved the experience for all stakeholders involved. Customers now have the option to apply online through an easy-to-find and easy-to-use form with no in-person visits required. This new application has shortened wait times by almost 90% and eliminated 60% of the steps required by the original process. Customer satisfaction with the new application is high, with customers rating the process a 6.2 out of 7 and applauding the ability to track the application process and ultimately receive their disability placard from the comfort of their homes. Service Oklahoma represents a profound shift in how Oklahoma's government interacts with its citizens. By focusing on simplicity, accessibility, and efficiency, we are positioning Oklahoma as a leader in providing government services that meet the evolving expectations of our citizens. In closing, I sincerely appreciate the opportunity to tell our story. Service Oklahoma's journey is a testament to what can be achieved when we prioritize the citizens' needs. We are eager to collaborate, share insights, and work together to unlock the virtual front door to government services for everyone. Thank you for your time, and I look forward to your questions and discussion.
Mr. Doyle, thanks for your testimony. Next, we turn to our fourth and final witness, Mr. Lickley. Ms. Lickley, sorry.
Thank you. Hello, members of the committee. My name is Ashley Lickley. I would like to thank Chairman Casey, Ranking Member Braun, their teams, and the other members of this committee for this opportunity. This has been a top initiative of mine since I joined the mayor's office in 2021, so I'm honored to be here with you all today. The rush to go virtual during the onset of the COVID-19 pandemic revealed that most functions of daily life were easily able to be digital. But more importantly, it exposed just how inaccessible much of our digital spaces are when improperly designed or designed without the user experience in mind. The COVID-19 pandemic also revealed how vital and sometimes life-saving it is that all people have equal access to information from their federal, state, and local governments. Governments have utilized digital spaces to provide pertinent information as a means of engaging with the public for decades, yet still fall short in providing fully accessible digital spaces. The ADA greatly influenced the inclusion of people with disabilities in the built environment, but there remains a large gap in digital spaces. Governmental entities want to be accessible to and inclusive of their residents. But unlike stairs or narrow walkways, inaccessible features of websites and other digital spaces are invisible to those who do not rely on them unless they have been trained to seek out and remedy these barriers to access. Salt Lake City's current website templates are often inaccessible with little ability to adjust template features. The city is migrating to a new system that will allow for greater flexibility in fixing any accessibility issues. This migration will also allow the city to utilize APIs from other local apps to build what our residents and visitors need to navigate our digital and physical spaces more independently. This move away from some third-party app developers is vital to the engagement of people with disabilities in our city. Recently, I worked with our Information Management Services team, a Low Vision resident, and the city's Accessibility and Disability Commission chair, who is a blind individual, to identify ways the City Request app was inaccessible to them. When reviewing this with the developer, they informed us that some issues were well known to them and would not be fixed in any upcoming updates. Therefore, this app would remain inaccessible to the resident and others like him. We can create an accessible user experience with our new website and apps through partnerships like the National Federation of the Blind of Utah and through the expertise of our city's Accessibility and Disability Commission. But having implementation guidance from the federal government would further improve the design and development of these spaces. Designing digital content with all users in mind is also crucial for civic engagement. People with disabilities have been underrepresented in civic engagement efforts or entirely prevented from participation in civic engagement efforts throughout history. Therefore, utilizing WCAG 2.1 in digital surveys and other digital engagement content is vital for the inclusion and participation of our residents with disabilities. Our civic engagement team collaborates with me often to review accessibility before surveys are released to the public. This team is also compiling a style guide for creating engaging and inclusive surveys. We value the contributions of and feedback from the disabled community in improving our city and work to make sure our content reflects those values. Data shows, on average, people with disabilities make up roughly 25% of the population. This is a significant amount of people that may not be able to perceive, interact with, or understand the digital content governments create, which can result in frustration, lack of engagement, and, at the very worst, feelings of isolation. Adopting WCAG 2.1 would be a much-needed step towards the full participation and independence of people with disabilities. It is imperative that entities understand how to comply with WCAG 2.1, so I urge the Department of Justice, U.S. Access Board, and ADA National Network to be diligent in creating technical guidance, especially plain language guides and trainings for entities as they implement these regulations. Thank you all for your work on this vital effort for inclusion.
Ms. Lickley, thank you very much for your testimony. We'll turn to our questions now. I'll start with Mr. Westbrook. Chris, you shared your experiences living with disabilities, and you also have worked as both a software engineer and now as an accessibility engineer. Through both your everyday life and your professional experience, you know about barriers, and you highlighted some in your testimony that exist in modern technology. You know that inaccessible technology can limit independence and place a person at personal and professional disadvantage. Can you share with us a little more about how inaccessible federal, state, or local websites can affect the day-to-day life of someone with a disability?
Sure. So I just heard from a friend yesterday about this new, they were trying to file for unemployment and they were stymied, I guess you could say, by this ID and Me. I guess it's like a new way to verify somebody's identity. It uses a camera and stuff like that, and they couldn't get past it. And, you can imagine, you've already, you've lost your job and you're trying to file for unemployment, which is stressful enough. And then, to have that barrier in your way is just, creates additional stress and isolation even sometimes. So, yeah.
And you had made reference in your testimony about when you were completing a form. I don't know if you could just refer back to that, completing a form and just finding the right button and barriers like that. Can you walk through that?
Yeah, so buttons need to be coded in such a way as to be so that the screen reader can tell that they're actionable buttons. And if they're not coded the right way, they can just look like normal text, and sometimes even if you do think it is the right button, if you hit enter on it or whatever using a keyboard, it doesn't work because it's expecting a mouse. It's set up for a mouse user to click on it. And sometimes, depending on how it's coded, no amount of keyboard input will make it work. And that was the case with that particular form.
So is it true you end up using kind of workarounds to compensate for it?
Yeah, there are a few services out there. One of them is called Aira, A-I-R-A, and that is a service that you can call and get a sighted assistant to, well, they can do anything, but they can connect to your computer, in this case, through remote technology and control your computer as if they were you. So you can tell them what to do and they can help you navigate the website. But that's a paid service. And so, it's not free, so some people might not be able to afford it. You only get a certain number of minutes per month, so it's really important that technology be made accessible and that these workarounds are just that, workarounds. Sometimes we just have to get the job done. We just have to do what we need to do. But ultimately, it's really important that technology be made accessible.
Yep. Well, thanks very much for that. Ms. Othman, I'm going to make reference to the history, the 50th anniversary of the passage of the Rehabilitation Act amendments, as I mentioned earlier. These amendments were really groundbreaking. It, among other things, created the U.S. Access Board. The Act states in part that it requires, quote, access to programs and activities that are funded by federal agencies and to federal employment, unquote. For both the public and for federal employees themselves, a key pathway to accessing federal agencies and programs is through the technology that we've talked about. The Department of Justice issued a report 10 years overdue that showed that only 20%, just 20% of federal websites are accessible at best. I'd ask you this, what do you consider the most common barrier to website and technology accessibility at all levels of government?
Thank you. That's a great question. I believe that the most common barrier to website and any type of application related to technology is knowledge, education. People don't know that they have to do it, or they don't know how to do it, and so they don't do it. The other, on par with that, is also prioritization. If we prioritize accessibility at the same level that we prioritize security, privacy, other technology-related aspects, so many people with disabilities wouldn't be left behind, because there are problems with privacy and security when you are standing at a Social Security kiosk and you have to use a security guard or you have to use a bystander and tell them your Social Security number so that they can get you into the kiosk to tell Social Security Administration that you're there for an appointment that you've pre-scheduled. Or when you are standing there talking to the receptionist at the VA, sharing your medical history so that they can fill out an inaccessible form for you. And now they and everyone within earshot can hear you. And so I think it's both the lack of knowledge and understanding, but also on that same level is the non-prioritization of accessibility on those same lines as security and privacy in the federal space.
I think it's a good way to think about it. Ranking Member Braun.
Thank you, Mr. Chairman. I'll have two questions for Mr. Doyle and one for Ms. Othman. Mr. Doyle, your service, Oklahoma, is on the front lines, it seems like, in Oklahoma on innovation. When I came to D.C., I wanted to make sure my own offices here, and especially back home, did as well as customer service in the business I ran for 37 years. When you take that customer service to a new level, I think it shows how you can do at any level something better than maybe what was done before. Tell me how prioritizing customer service there in Oklahoma has enabled you to take it to the next level, and will it actually aid in a way to expand it further?
Thank you for that question. For us, we put the citizen at the front of everything that we do. It's the center of our business. Our name is Service Oklahoma because we are here to serve our citizens. And so we would be doing a disservice if we didn't design our services with our citizen in mind. And so anything that we actually build, design, change, we start with actual citizen interviews, having conversations with the person that's actually going to be using the product, of trying to determine their pain points, trying to figure out their feedback on what will work and what will not work. And we also want to believe that our methodology is really iterative. And so even after those initial interviews, that's not where the feedback loop starts for us. Is even after we initially launch a product, and even into all of our products today, at the end of every service, it actually asks a citizen for feedback. And we want feedback for how can we improve the service we just provided or offered you. And then we actually take that to heart and actually continually try to change and improve the products that we offer. Because as we continue to improve our products and better meet the needs of our citizens, we're improving our first-time resolution rate. We're decreasing our transaction times. We're actually making our services more efficient for the state and actually a better product for our citizens. So, we view feedback truly as a gift. It's the driver of everything that we do. The products in our product roadmap of what are we going to innovate or what are we going to improve next is really truly driven by customer feedback and what are the needs that we're hearing and seeing on the front lines from our citizens.
Thank you. Second question would be involving federal regulations. Whenever we're going after improving or doing it right in the first place, there sometimes can be a conflict between. Sometimes it works well together. How have the federal regulations dovetailed with what you've been trying to accomplish in Oklahoma? And has it made it easier or harder to arrive at better results?
We always are looking at both our federal and state regulations. Obviously, we're in a fairly regulated, highly regulated industry just from the services that we provide on a day-to-day basis. We want to be sure that we're not violating any statutes, both federally and locally, as well as jeopardizing any potential funding. So I think those are obviously key items that we're looking at. I'd say additionally, we're examining how can a burden of regulations or compliant requirements have on the speed to launch or the cost to actually implement a product. So I think we're definitely having those conversations and concerns as we're looking at future products. But for us, the really decision-making for where we go with our products and how can we actually provide us a better service is really, again, back about the customer. Is it going to generate a substantial benefit for our citizens, either through a simpler experience or more accessibility to services? What are our development or ongoing costs going to be when we're launching a new digitally enabled product? Because ideally, that shouldn't cost us any more than it was previously to offer that service. So we really want to be focused on being good stewards of taxpayer funds. And then finally, what's the impact on the citizen? Is it going to impact a high number of citizens or have a significant impact to their lives? Are really the real drivers we're looking at when deciding what services to kind of bring online.
Thank you. Ms. Othman, last August I joined Chairman Casey in asking the GAO to study the federal government's compliance with Section 508. This study will examine how the federal government complies with laws requiring accessible technology. In your opinion, to what extent does the federal government comply with laws requiring accessible technology?
Thank you, Senator, for the question. In my opinion, and based on my experience with my constituents, I can tell you that I believe the federal government is largely and substantially non-compliant with Section 508 across the board, that this is a systemic issue, and federal agencies that do comply are rare and far between. I can also tell you, Senator, that the number of complaints that are cataloged and processed is both significantly less than the number of issues that actually exist, and also based on underreporting to Congress and other entities. Most federal agencies don't have a structure for 508 complaints processing, so we don't actually know how bad it is. Added to that, no employee wants to sue their employer or file a complaint. Most employees will try to find workarounds. They will spend lots of time doing this. Most individuals with disabilities solve 100 problems before they even show up to work in the morning. And so if these were simple problems in terms of inaccessibility, they would solve them themselves. No employee wants to make themselves vulnerable by going to their supervisor or their agency to say, I'm struggling to do my job, period. Let alone because of something directly related to their disability, meaning the inaccessibility. And so while I absolutely applaud and support the GAO study, I'm also deeply concerned because I do not believe that federal agencies are properly keeping records or that there's an accountability or enforcement mechanism in place to accurately capture the number and volume of inaccessibility or the individuals that that impacts.
That is disappointing to hear, and I think it ought to give us pause before we try to maybe do more through the federal government when it seems to be clear that it's not complying with some of the things it's put out there. And I think it also means that we've got to make sure that states, especially the ones that are wanting to be innovative, are out there to where they have full flexibility to probably do a better job. And sadly, we've completed in my own office as a freshman Senate office 10,000 cases back home across the array of federal entanglements, and that's an amazing number in a little under 5 years. So I just think hearings like this expose, in a way, the truth of what is being done, what is not being done. Practice what you preach, and please make sure that we keep the flexibility for states to do what appears to be a better job with a report like that. I yield back.
Thank you, Ranking Member Braun. We'll have to take a break in the hearing now. This hearing of the Senate Special Committee on Aging will recess so that members can attend an all-senators session to hear from Ukrainian President Zelensky. The committee will reconvene in this room after the session concludes at approximately 11 a.m. This committee stands in recess.